So I'm not going to talk very long, but first of all, I would like to say thank you again to the co-editors of The Pandemic Divide, Gwen Wright, who is also the person who shaped and managed this conference. She had dedicated support from our grants manager at the Cook Center, Joanne O'Neill, as well as our communications specialist, Maddie Braxick. And then there's our additional co-author, who I must mention, Lucas Hubbard, who is a phenomenal writer and helped us bring this project to fruition with what we hope is a high degree of quality. So, thank you, Lucas. This conference could not have taken place without the partnership with the Robert Wood Johnson Foundation, and I have to emphasize that. So, thank you to the foundation for their support. One of our objectives in this conference was to come away with an agenda for policy. So what I would like to conclude with today is a set of observations about some of the policy proposals that seem to have emerged from the conversations that we've had. I'm thinking in particular of Sandra Barnes's discussion with us today that suggested that in the midst of a pandemic, there are certain core social organizations that we need to find the best way possible to have them continue to function without aggravating the spread of the disease. And Sandra Barnes's conversation was about the churches and the trade-off between the cost of loss of our social interactions and exposure to the disease. One way in which we've attempted to try to address that during the course of the pandemic was by having people engage in Zoom activities. And so we need to think about how we can improve that when it's necessary to move away from face-to-face contact. At minimum, we should have access to universal Wi-Fi, but we should also create an environment in which people who are not knowledgeable about using the internet or about Zoom can get support and help in doing that more properly. And we also learned in the course of this conference that many Spanish-speaking families refer to it as Wi-Fi. So, okay. Now, the other theme that came clearly into play in the conversation just now is that it's not a great idea to restore pre-pandemic educational practices. And I would say that there's a more general point here, is that there's a host of social practices that were taking place prior to the pandemic that we do not want to restore. And so to the extent that there's been a disruption in our lives and in our policies that have been caused by COVID-19, perhaps it is in an odd way an opportunity to really turn the corner and do innovative things that needed to have been done before the pandemic took place. Then there was a high degree of emphasis during the course of the conversations today and yesterday on the essential purposes of creating a receptiveness to vaccination across the population, and also to equitable treatment in the course of a pandemic or in course of any situation with respect to health, both in terms of the quality of medical care that people receive, which is going to be contingent upon reforming medical education, as well as in terms of their access to insurance. I also think we should highlight Craig Waleed's key point today that we need to end solitary confinement in the prison system. And a final observation returns to something that I tried to emphasize at the very beginning of the conference, is that there needs to be compensatory action or redress for a host of atrocities and harms that have taken place that affect the lives of Black Americans in particular with respect to economic opportunity and economic security. And so the other policy that I would like to leave you with is reparations for Black American descendants of U.S. slavery. Thank you.